Hi everyone, I'm Todd. So appreciate what Breena has to say about that. I mean, I think we could all recognize that communication's paramount to us being able to intervene or advocate for any of these patients. I'm going to tell you a case. I'm going to illustrate some issues related to immigration-related trauma, how that affects people's lives in their country of origin, in their migration, and then often when they get to the U.S., how it continues to compound and deepen the vulnerability of these patients. So, tell you about a case that I had at Ronald Reagan UCLA, where I came on as the attending. This was a patient who had fallen from a ladder and had received a pan-CT scan and was pending MRI of the back because no one could figure out why she couldn't get up, and she would just scream when people tried to examine her. I go into the room after her MRI is done, and she's laying there with a vacant stare. Her sister-in-law is sitting in the room. Trying to examine her, she just kind of screams, "No me toca," and kind of doesn't comply with the exam. Asking what is going on to her sister-in-law, she explains kind of her all too common but unfortunate backstory that she was a resident of Guatemala the year before, where she was being extorted by a local gang, had a sewing business where they were asking for increasing amounts of money, and then trying to continually extort more and more and more, and eventually started threatening family members and other things when she couldn't pay. She made the decision to hire a smuggler to take her and her family to the U.S. In the process of that, she was picked up, actually sold by her smuggler to a local cartel, the Zetas, who kidnapped her, ransomed her, and victimized her for about 6 months, while her family was able, in L.A., was saving the money to pay for her ransom. So, talking to her sister-in-law, she says, all this stuff's happened. It's been really hard. She's not the same person. She isn't able to even care for her kids anymore. They really have to rely on the rest of our extended family. She isn't able to kind of communicate the same way. She does this sometimes where she does this vacant stare, kind of like she's doing right now. She has all these flashbacks. She has terrible dreams. She screams at night. We're not really sure. She doesn't want to get health care because she's afraid of, anything that's going to draw attention to herself. She's currently working as a housekeeper in, a wealthy Westwood neighborhood where her employer has required her to wash windows with the ladder outside, even though she's pleaded with them that she does not know how to use a ladder. Then comes to you today because she has subsequently fallen from that ladder. So after hearing this whole story, understanding that, you end up realizing that, this whole scan kind of trauma workup was probably a little overkill. You give her some meds, help her calm down, she walks out of the ER. What does this case illustrate? A number of things, especially related to trauma people have experienced on multiple levels and in multiple places. So first of all, trauma in her country of origin. One of the best papers on this is this study by Eisenman and JAMA, where basically they went to a bunch of primary care clinics and surveyed Latino patients, saw a trend that's been increasing in the last 10 years where we see increasing political violence. Over 50% of the folks that were interviewed in the survey had political or other violence in their country of origin, causing them to flee, that actually had high associations with PTSD, depression, all the stuff you guys already know, right? And that was kind of one of the issues that had made them emigrate. So this is a change in migration patterns and the demographics of the people we're seeing. They are not the typical NAFTA migrants of the past that often labeled as economic migrants, right? These are much more of a refugee type population over the last 10 years. Then, to compound that previous trauma, usually in country of origin, there's been a lot of destabilization of migration routes within Mexico, and that has become an area that gangs and cartels have used to exploit and victimize folks along the way, causing massive amounts of sexual and other assault of migrants on the journey. This is a study that MSF did in their basically migration clinics and looked at staggering rates of both sexual and physical assault and astronomical subsequent PTSD and depression. So, knowing that people have this history getting to the U.S., now we enter the U.S. climate. And I probably don't need to tell you too much about the somewhat adversarial stance the government and other groups have taken against these folks, and increasing ICE presence, increasing perception of immigration enforcement, and the constant threat of further prosecution for being an undocumented person. This is a guy I've met actually in Tijuana who was deported from just down the street from where Breena works, and all of you, in Van Nuys, on his way after dropping off his daughter at school, going to his mechanic shop for a 15-year-old drug-related crime. And he has not been to Mexico for 20 years, does not really know the place anymore, and is currently deported there, trying to figure out what to do with this situation. And this is the pervasive fear that folks live with once they do get to the U.S. and once they are, in the land of opportunity. So what does that do for us? What does that do to their health-seeking behaviors? How does healthcare utilization affected by this kind of amalgamation of trauma, fear, and basically fear-inducing situations? So we know from a number of studies that have been done after anti-immigrant legislation was passed, Prop 187 in California, Arizona had a number of these, as well as Georgia. And this is a psych study, and then prenatal and well-child checks for mothers, and then pediatric emergency department visits. And so looking at these, I'm sure you guys can all guess what happens. People go to less preventative care, less well-child visits, less preventative and kind of primary site care, and they present with higher acuity visits as a result. And we're already seeing a lot of this kind of issues in regards to our data on law enforcement and people's willingness to seek things like telling the cops that you were a victim of domestic violence or rape. We've seen in LA, our rape reporting among Latinos dropped 30% since 2016, and similar in Houston, about 30 to 40%. I don't think that's because the actual crimes are decreasing. So, we're going to talk about a couple things you can do about that. One of them being creating a different dialogue when it comes to healthcare settings. And one thing that we're lucky enough to benefit from in LA is the Safe Spaces Initiative, where before we were a sanctuary state or anything else like that, the health system decided our hospitals, our health clinics, our medical settings are not places for ICE enforcement. They are places where people need to acquire health and health supporting behaviors. So this is actually a sign from New York where it says we care about your health and not your immigration status. But that's the kind of culture we need to build around our healthcare, and we need to advocate for things that not necessarily subvert the law, but hold the health of our patients and the advocacy of their health at a higher standard than anything else, because that is technically our job. We're going to talk about a number of other legal and other pathways to aid these patients with Dennis here in a second. But just to give a follow-up on that case, she was able to get a T visa and is now currently in the process of getting legal permanent residence in the U.S.